Hello, welcome back to the Prince Medical TV. Here's your guy, the Prince Kelvin 28, and welcome back to yet another episode of Health Talk. And in today's video, I want us to talk about recurrent urinary tract infections, commonly known as UTIs. So, for those who don't know what UTIs are, it is a bacterial infection, any bacterial infection that affects any place along the genital urinary tract. That could be the urethra, the ureters, the bladder, or even the kidneys. So any infection of the mentioned is what we call UTIs. So what keep on bringing back UTIs? We said sometimes no matter how many times you treat UTIs, if you keep on doing the same things, the same practices, you will keep on having the UTIs no matter how many times you treat them. So what are some of the practices that you do that keep on bringing these UTIs? So if you keep on douching, what is douching? Douching is cleaning inside, deep inside your vagina. You're not supposed to clean deep inside your vagina because we all know that the vagina is self-cleaning. It has a way or a mechanism of cleaning itself from inside. So the only part you need to clean on your vagina is you don't need to clean your vagina. You just need to clean your vulva or the outside of your vagina. You don't need to clean the inside. So douching is one of the practices that keep on bringing back the UTIs. So stop doubting. The other thing is about steaming. Steaming is whereby you prepare hot water and put on some herbs inside that water. Then from the steam that is coming out, you sit on that steam to try and clear vaginal odor. You don't have to do the steaming. If you have a vaginal odor, that means you have an infection. Go and see your physician. Go and get treatment, the right treatment. Stop steaming. So steaming is another practice that will keep on giving you UTIs. So there are also other people who do masturbation. Now, for those who do masturbation, you do masturbation with unclean hands. You don't wash your hands before masturbating. You insert objects that are not clean. So inserting of objects inside your vagina are likely to give you recurrent urinary tract infections, no matter how many times you treat them. The other thing is about wearing not very dry panties. Not very dry panties. They carry some moisture and some bacteria, and so if you keep on putting on some panties that are not very dry, you're likely to keep on getting these infections. So you need to iron the panties if they're not dry, or sun dry them. So the other practice is putting on nylon panties. Now, what happens when you put on a nylon panty? A nylon panty doesn't release moisture. It retains moisture. It doesn't give room for free circulation of air within your vagina. It doesn't. It retains that heat, retains that sweat, and this gives more room for bacterial growth and holding on to the bacteria, maybe from your skin, that is from your thighs, from your perineal region. So now when you hold on to that bacteria or that moisture, you end up getting UTIs. So avoid nylon panties and normalize putting on cotton-made panties. So the other practice is about oral sex. Now, if you're having oral sex with someone, you need to make sure that that person have to brush their mouth or their teeth before they get down there. Why? Because unbrushed mouth or teeth has some bacteria that will be carried or will be taken to your vagina, and you end up getting the UTIs. So those are some of the practices that you keep on doing that will keep on bringing back the UTIs. So what are the signs and symptoms of UTIs? Now, there is turbid urine. It looks cloudy urine, or yellow. The urine looks so yellow, dark yellow. So if you have that, you suspect that you have UTIs. Again, if you experience urinary incontinence, or this is involuntary release of urine or leakage of urine, that is also another sign. If you're having lower abdominal pain, if you're also having painful sex, if you're also having painful micturition, or when you're urinating you're feeling pain, or you have that burning sensation when you're urinating, those are some of the signs that will tell you automatically you have urinary tract infections. So how do you treat them? I would not advise you to treat yourself or self-medicate if you keep on having recurrent urinary tract infections. I would recommend you to go to your doctor, go and see your physician or your clinician. Let them guide you and let them give you the drugs or the medication that you need. And after that, after getting the medication, make sure you check on the practices that I have mentioned. Stop doing those things and thank me later. Thank you for watching this episode. See you.